Hi, I'm Brian Martinez. Student intern Brian Martinez. Today I will be performing the TNET Fall Risk Assessment. Okay, for the first one, I'm gonna be like, can you please sit down? I'm gonna be looking my patient for 2 minutes or close it like that. I want him to look steady and stable. If the patient loses balance or needs to hold something, you're gonna score 1. And if the patient is unable to lean, you have to lean to both sides, is 0. So 3 is the maximum one. Is 3, 2, and it's 2, 1, and 0. Okay. The other one is can you please stand up? Yeah, in this one I'm evaluating how the patient stand up, okay? If the patient don't have to hold to nothing, it's 2. If the patient need to use their arm, is 1. And if the patient is unable or need like multiple attempts, is 0. For in this one, after the patient raise from that chair, stand up, I'm looking how balanced he is after that. If the patient can hold that balance, patient scores 2. If the patient is unable to hold that balance, the score is 1. And if the patient fall or is unable to stand up and stay there, is 0. Okay. The other one is like just feet together, please. Okay. For this one, I'm gonna take the patient. If the patient can hold that position, can score 2. If the patient is unable because it's like leaning to the side or looking for balance, is 1. If the patient is unable to be like this, is 0. Because they need support. Okay? Standing, feet together. Okay. The next one is balance with eyes closed. So we're gonna stay there. I'm gonna close the eye. And if the patient is steady with feet together, patient scored 2. If the patient is steady but need the feet apart, is 1. If the patient is unable to hold on, is 0. Okay, for that one, you can open your eyes. For this one, I'm gonna put a little bit of pressure in the sternum. If the patient is unable to hold this, if the patient hold this 3 times, let me reject that. If the patient is steady for 3 time push, it's gonna be 2. This is pretty good. Okay. If the patient is unable or have to move the feet to keep the balance, is 1. If the patient is unable to hold that pressure, that light pressure in the sternum, is 0. For the other one, it's 360 turning. Can you please turn one side? There you go. Good. Okay. Then, can you do it to the other side? We're turning to both sides. Okay. If the patient continues without grappling or staggering, is 2. If the patient has discontinued turn, is 1. Or need to like hold something, is 1. If the patient is unsteady or hold on, just to stop, is just 0 for this one. The next one is neck turning. Can you please look to your left? Good. Can you please look to the right? Good. Okay, for this one, if the patient is unable to roll horizontal and vertical, steady, is 2. If the patient decreases the ability of steadiness, is 1. If the patient is unsteady or symptomatic, is 0. For the other one is standing in one leg with the eye open. Can you please stand on one leg? Thank you. You can relax. We'll do this in both legs. For this one, if the patient is able to stand for more than 5 seconds without holding on, is 1. And if the patient is unstable, is 0. For this one, I'm going to need you to just lean backward like this. Good. And go back. extension without holding on, 2. Try but decrease range of motion to hold on is 1. Unable or not attempt or stagger is 0. Reaching overhead. Can you try to reach something overhead? Like, good. You can relax. Able to take an object without holding on or becoming unsteady is 2. So if the patient is grabbing something from overhead and is able to do it without wobbling, it's 2. But if the patient is able to reach but won't hold on to something, it's 1. If the patient is not able to do any of those, it's 0. For the other one, can you please bend down? Try to touch your toes, please, for me. Good. I'm looking for able to smooth. Can you go up again? I'm looking for a smooth motion. If the patient have a good control, it's 2. If the patient needs to use their arm to support or is wobbling, it's 1. If the patient is unable to do this one, it's 0. Now, the next one, I'm going to evaluate the gait of the patient. Okay, can you please? Okay, can you step up facing me here? Like, step up there. Okay, can you please do 4 steps towards me? Yeah. Good, you can relax. And this one, I'm looking for initiation of the gait. If the patient begins immediately, single smooth motion is 1. If the patient has trouble starting the gait, is 0. A step high. I'm looking, while he was doing that, I was looking how far from the floor he was getting it. So a good score is like 1. So I will be looking both feet bilateral. So I will be looking the left foot and the right foot. So I'm looking to be like almost like 1 to 2 inches in both sides. If the patient is not able to reach 1 to 2 inches from the floor, it's 0. Okay? Now for the other one, I will be on the side of the patient. Can you step there, please? Can you walk towards here? And looking the length of the steps. It was really good. For this one, I'm looking for like a left and right foot. For this, right foot passes left foot and left foot passes right foot. In both foot. So if each one pass each other is 1. If the patient is unable to pass either feet is 0. Okay, step symmetry. Same both sides. So I will be looking for symmetry. The patient is not leaning more to one side or is having more inversion or pronation or whatever. Those, I'm looking for symmetry for this one. If it's same or nearly, symmetry is 1. If the patient lose that, it look different in both sides, it's 0. So other thing is like I'm looking while he's walking, I'm looking that he don't break that pace. So he keep a good pace. So he doesn't have to stop while he's walking. If the patient is continue walking, is 1. If the patient stop or break the pace, is 0. Okay, that is step continuity. Path deviation. Okay, for this one, I'm gonna imagine that you have a straight line here. Like, step there, please. And just imagine that there's a straight line here, and walk to that line. Yes, there you go. Perfect. For this one, patient will be straight following a line. If the patient follow the line, is 1. If the patient is unable to follow the line, is 0. Trunk stability. So for those this one, if the patient like have it stable, it's normal. So it's 2. Like he's walking without like leaning, like without having the stability of the trunk. If the patient knees are back flexed, arms adducted for balance, the patient is kind of doing this. So it's looking for balance, that is 0. Sorry, that is 1. If the patient is not, is market swaying a lot, is 0. Walk stance. So I'll be looking how wide is the stand. A normal like stand, big like him, smoothie, like stable one. If the patient has a stable stand, while walking is 1 because it's not supporting anything, it's not holding anything. If the patient is not able to do that, is 0. Turning while walking. So can you step there? Okay. So walk towards me, and then can you turn to that side? There you go. Nice. Perfect. For this one, normal and continuous turning is 1. Unable to turn or stop to turn is 0. I will be scoring all this to my patient, and after that we'll have my score. This score will help me to know how this patient is at risk to fall. Okay, thank you. Thank you.